Thank you so much for listening to the Pound This podcast. I am Amanda Valentine. I have two guests today. Dr. Dan Pelkowitz from the Christ Hospital Health Network. Hello.
Hello.
And Duke Hamilton from B105.
Hello.
What's going on, Duke?
Oh, I'm just excited to talk about this crazy heart of mine.
Yeah, well, I'm excited to hear about it because, it's Heart Month, which means it's the perfect time to think about things going on with your heart, like your AFib, and to get things checked up. And I know that, for me working with you for so many years, that you talked about you would get off the air here at B105 and go up to Christ Hospital and have to get, checked up on your heart. So, what's going on with you? You have AFib. How long has that been going on?
I think I've probably had it in one form or another, probably 20, 30 years, maybe.
Really?
But it was always a thing where, I was doing great, and every once in a while I'd have this heart palpitations, where we would beat fast, and I would just think, oh, well, it's not a big deal because it would only last maybe, a minute, and it would go back into normal rhythm. And I didn't think that much about it. I thought it was just, that's the way things are with my heart. Then probably 3-4 years ago, it got to the point where it would last longer. The periods of palpitations would last longer, take longer for it to go back into regular rhythm. And not only that, but then I noticed after a while that the heart was completely out of rhythm. All of a sudden I woke up one morning and it wasn't beating that fast. It was just beating abnormally.
But Dr. Pete, you have a crazy title behind you. What's your title again?
I'm a cardiac electrophysiologist.
That sounds so smart. It sounds like you're so much smarter than me.
Well, we usually just say heart rhythm doctor.
Okay.
I think that's a little bit easier to comprehend.
So this is your specialty then. So whenever people like Duke, their heart starts going out of rhythm, then they get sent to you and you're just like, okay, let's figure this out and fix you?
Well, there's a lot of ways that we treat this problem, and actually this is a very common problem that we see. AFib is very interesting because people may have no symptoms whatsoever, or some people can have the typical symptoms that Duke had.
So what happens if you don't have any symptoms then?
Well, a lot of times it's not even picked up until you go to your primary care physician and they do an EKG and they notice that your heart's in AFib. Sometimes we don't find people until they came in with a stroke.
Oh, yikes.
Yeah.
So whenever you get a patient like Duke that comes in, what's the process of trying to reverse it? Can you reverse it or just fix it, or what's the process?
Well, everybody's different. So it all depends on what your risk of stroke is, and it depends on what your symptoms are. Okay?
Mm-hmm.
If you don't have much of a risk of stroke and you don't have many symptoms, there's actually not much we have to do for you with your atrial fibrillation.
Okay.
Where we have to do most of the work is where people have lots of symptoms related to their AFib. So people who are really fatigued, really short of breath, having lots of episodes of atrial fibrillation. And treatment can range from simple observation to medicines to even invasive procedures to treat this.
So what are the dangers if you're noticing some of the symptoms where you can just feel like your heart's out of rhythm, you're kind of feeling fatigued like Duke was, and you just don't do anything about it? Then what happens to you?
Yeah, so many people will get away just fine if we do absolutely nothing with their atrial fibrillation.
They just feel uncomfortable all the time.
Right. But the biggest concern is actually the risk of stroke. That's the really big medical problem that's associated with atrial fibrillation. Now, I want people with AFib to know that you're not a ticking time bomb. The risk of stroke in AFib per year is somewhere between 2 and 8%, depending on your risk factors. Mm-hmm. But that's a pretty big risk when you measure years and years of atrial fibrillation. So that is the thing far and away that we need to treat when we're treating AFib. Well, we think there are a lot of things that cause these problems. So one is just luck. So some people just develop this problem.
You're so lucky, Duke.
I know. Always been that way.
But then, there are some things that certainly are associated with atrial fibrillation. So people with high blood pressure, you need to have your blood pressure treated correctly to reduce that risk, okay? Diabetes. The diabetes needs to be well controlled if you have diabetes, because otherwise you're going to be at a higher risk of AFib. And then maintaining a healthy weight is really important to reduce your risk of AFib.
So if you feel like this is something you need to look into, get a primary care physician, go to thechristhospital.com.